If your wrist hurts here, this is the perfect video for you. Learn what it is and how to fix it. What's up guys, Dr. Joe from Identity Physical Therapy, and today what we're going to be talking about is Triangular Fibrocartilage Complex, aka outer wrist pain. I want to talk about what it is, how it develops, and then how we fix it here at IDPT using our IDPT realignment method. So by far the most common wrist pain and wrist injury is TFCC. And what that is a sprain or inflammation at the outside of the wrist, specifically between the ulna, which is the outer forearm bone, and the pinky side of the hand. What happens is there's, as the name describes, a triangular formation of ligaments that holds that area together, holds the wrist and the hand together. But because of how the human body twists and compensates, it's very, very susceptible to getting pinched up and getting inflamed. This bundle of ligaments is getting constantly compressed under load, which is what's giving it the inflammation. So let's talk about why does that happen. This happens because the wrist is stuck in an ulnarly deviated position and pronated forearm, which is going to further close down this area. Because when we think about internal rotation or pronation at the forearm, we know that the ulna comes over towards the radius, and when that happens, it bunches up this whole ligament area. And that pronation is associated with internal rotation. So someone who has this ulna raised up tells us that their entire arm is in an internally rotated position, because ulnar deviation is associated with internal rotation, and the ulna has to roll over towards the radius in pronation, which is also internal rotation. So when that happens, this area never gets a chance to breathe or decompress. Now, we know that internal rotation in the ID realignment method is associated with force production. So traditionally, someone who's stuck in this pronated grip is going to be for one of two reasons, but one, that they're constantly producing force. So it can be someone who's always lifting heavy in the gym, but it's also someone who's unable to correctly produce force, and therefore they have to compensate and twist harder into internal rotation. So this can be someone who's trying to get into golf, but they're not necessarily that strong, and so they're compensating at their wrist. Okay, so knowing someone who's having this issue is someone that's stuck in internal rotation at the arm, well then the opposite needs to be true. It's someone who cannot access external rotation in their body. And so the treatment from IDPT's perspective is that we need to give back external rotation all along the hand, all along the wrist, all along the arm. And so the way that we do that is by getting supination back in the hand and the wrist to start to untwist this wrist, and then supination and external rotation in the elbow, and therefore in the shoulder. And the way that we do this is actually by working on the shoulder and then working our way down the chain. And the reason is because the shoulder is the closest to the thorax, which is going to be responsible for any compensations down the chain. So in order to gain external rotation back, first we need to open up the posterior aspect of the scapula and the thorax. The reason being is when this is squeezed and compressed down, the scapula is going to tip forward, which is going to force the shoulder to internally rotate, and that's when everything else follows suit. So in order to get this twist to undo itself, we need to create space and to create air in the back of the body to start to give that shoulder room to breathe. So the first thing that we're going to do is an exercise that's going to open up that upper back area and that upper shoulder blade area to begin getting external rotation back at the shoulder. So the first exercise that we're going to do is aim to, one, create space at the upper shoulder blade area, because that's going to let the shoulder blade come back. And then we're going to use a band to turn on the muscles at the back of the shoulder to help pull the shoulder into external rotation. So what you're going to do is get a mini band and you're going to wrap that around your wrists. And then I want to put my forearms flat on the wall below 90 degrees. From here, I'm going to kind of push my chest away to round out my upper back. I don't want to round out my whole back, just the upper back. And then because our focus is on external rotation, turn your palms to face you. From here, we're going to get a small, gentle pull of the band so that I feel the back of my shoulders engage. From here, I'm going to hold that press away from the wall, and I'm going to breathe into my upper back 6 times. And it should start to burn the back of the shoulders. So I'm going to breathe in through my nose softly and take a long breath out through my mouth. What I want you to do is 6 breaths, and I want you to do that 3 to 4 times just to get external rotation back in your shoulder. All right, next we're gonna do a concentration curl with an emphasis on the supination and the external rotation. For this one, I had no choice, but I had to take my long sleeve off because I gotta show the biceps. So what you're gonna do is rest your elbow on the inside of your thigh, and you're gonna grab any dumbbell. Typically, it should be a dumbbell that you can do about 12 to 15 reps on. From here, your focus is on curling this up, and when you curl up, I want you to turn your palm towards your face, and then as you go down, turn down to neutral. So when you turn down, don't overly turn because that's internal rotation, a position you're already stuck in. So I just want to turn down to neutral and then curl up into external rotation and squeeze your bicep. So we're going to go neutral, up and squeeze. The other thing is that I don't want to pinch my shoulder blade here. I want to kind of shift backward a little bit and let that all expand. So I'm going to curl in and here. Again, you want to go for about 12 to 15 reps, and you really shouldn't feel any pinching in that wrist. Focus on turning up. Go for 2 to 3 sets of this. All right, lastly, guys, I'm going to teach you guys a self-mobilization for your wrist so that you don't even need people like me. You can tell any physical therapist in your town, don't even worry, I got this. I follow Identity Physical Therapy on YouTube. So what you're gonna do is you're gonna grab your wrist with your opposite hand, and then all you're gonna do is turn towards the thumb side. So if you see this here, I'm literally turning this towards my thumb, and then I'm just gonna hold that stretch. I can literally feel it stretching like this area right here. So typically I like to hold that like 10 seconds at a time, undo it, go back into it. I can literally feel it pulling all through here. I like to go for about 6 times of that 10-second hold. And then again, so once you start moving your wrist, you're gonna feel a difference right away. All right, so to summarize, guys, if you have TFCC or inflammation and strain at these ligaments, it's because this ligament area is always under constant load and always getting bunched up. When this happens, we know that we have an entire arm and upper extremity that is stuck in internal rotation and ulnar deviation. So the fix is to give it the exact opposite. It's to give external rotation back at the upper extremity and to give radial deviation, or the opposite, the supination, so that this whole area can get decompressed and breathe again. So the way that we did that first is by expanding the upper back and the upper scapular region to start to give that shoulder back external rotation. From there, we're going to use a bicep curl variation to get that supination and that external rotation back at the elbow, and the hand is following suit as well. And then finally, we can use a self-mobilization to quite literally start to untwist your wrist. And when you do that, like we mentioned before, guys, you're going to feel the release and the relief at that area. So overall, the strategy is to fix external rotation at the shoulder, at the elbow, and at the wrist. And when you do that, you're going to start to feel like you can move your wrist again without so much pain. So guys, if you found this valuable, please, as always, like, share, and subscribe. Comment any questions or anything else that you'd like to see me talk on. I'll see you at the next one.